I'm Gina Adams, Senior Fellow at the Urban Institute, where I conduct research on childcare and early education policies. Thank you very much for inviting me here today. Let me start by setting some context. Childcare and early education is a reality for about 12.4 million children in the United States today, about 60% of all children in this age group. Children can be found in a variety of settings. Chairman Kildee's home. About 36% of all children are cared for in centers, about 15% by relatives, as we've heard, and about 11% by non-relatives in home-based settings. Children are in different settings at different points in their life and can often be in more than one setting in any given day. Parents' decisions about childcare are based on a complex blend of preferences and constraints: what they want, what they can afford, what is available, and what works for their child. Some families, including low-income families, working families, and families with infants and toddlers or who have special needs, face far greater constraints in getting the choice that they want. This context, I think, underscores two important lessons for policy. First, policy solutions need to focus on a variety of settings. And second, they need to address the multiple constraints that families face. We cannot just focus on quality without also paying attention to affordability and supply. I'd like to talk briefly about what children are getting in these settings. You already know that quality matters, but unfortunately the research has shown that the quality of much of the care in the United States is inadequate, and that quality may be worse for low-income children and very young children, two groups that we care very much about. This shouldn't be surprising. For most of our childcare settings, we have a market-based system where childcare providers can only charge as much as parents can pay. And if providers were to invest in the key components that we know matter, well-trained, well-paid staff, low numbers of children per adult, the amount that they would need to charge would make the service completely unaffordable for many parents. So providers have to provide services at prices that are lower than are needed for quality. And even at these lower levels of quality, families have to stretch to pay for care. For example, families below poverty who pay for care pay a remarkable quarter of their income for that care. Looking at the policy response, we have clearly come a very long way. Policymakers such as yourselves understand the importance of investing in this area and have made significant steps, most recently demonstrated through the stimulus package. We have invested more resources, though clearly not enough to serve all the eligible children, in helping families access good quality care, mostly through Head Start and pre-kindergarten services. These efforts have helped, though more needs to be done. But relying primarily on these initiatives to provide the good quality that children need is not enough. They primarily serve 3- and 4-year-olds, with the exception of the very small early Head Start program, though it's now doubled. Thank you. And because they most commonly are offered on a part-day, part-year basis. As a result, our most effective policy strategies to ensure that children are getting what they need in terms of quality are not reaching some of the most critical populations: infants and toddlers and children of working parents. Interestingly, these populations are served by the Child Care and Development Block Grant. Much of the focus of the block grant is to help families afford care so that they can work. But unfortunately, both the funding level and the design of the program make it much more challenging to focus equally on ensuring the quality of the care that the families use. Instead, in many states, the block grant is primarily used to help families access those very settings that I described a few minutes ago as being inadequate and whose quality is limited by what parents can pay. In addition, the funding levels of the block grant mean that state administrators are constrained in even their ability to meet the program's primary goals of helping parents work. Only a fraction of the eligible children are served, and administrators face very difficult trade-offs and constraints, limiting services, lowering provider payments, or making families pay more. The good news is that we do have states, such as you just heard from Pennsylvania, that have managed, despite these constraints, to make remarkable progress in using the block grant as part of an overarching strategy to support quality care for a broad range of children. However, as you also heard, they are very seriously limited in what they can do by the funding constraints and by the design of the program. These realities of the block grant challenge its ability to support quality for the families it serves and to coordinate with other systems to build a comprehensive approach for families. In closing, I'd commend you for focusing on these issues and for thinking about how to address the quality gaps in our early childhood policies, and specifically those affecting our youngest children and the children of working parents. In this process, it's critical to focus on the investments and strategies overall in our systems, but also to make sure to focus on those that will allow the block grant to be a strong partner in this effort. The block grant already serves millions of the low-income children that we care about. State administrators need the resources to ensure that wherever they are, these children and their providers have access to the supports that they need to build quality and to support their development. Thank you very much.